Lovely to see you all, and what a fantastic morning it's already been. I have just found the conversations to be electric, frankly, and really grateful to be part of it. Look, for those of you who don't know me, I'm Sarah and I'm the Chief Executive at Mind. I should also confess that I'm also a non-executive director on an ICB. Don't shout. All right. Very proudly, though, have to say. And look, I've worked in mental health and social justice and criminal justice for about 35 years, and originally trained as a social worker. And the reason why I particularly have an interest in moral injury is very much because it was part of the social work training that I did way back when, in about 1994. And I remember the conversations during that training with colleagues around, you know, those moments when you have to take a child away from a family, when you know that the fault of that situation doesn't lie with the family alone, when you have to section somebody under the Mental Health Act, when you know that the crisis that they've found themselves in isn't down to themselves alone. And so moral injury has become a kind of a thing that I've always thought of and understood. And then I was fortunate enough to be chair of a Forces in Mind Trust funding group and was able to fund one of the first studies into moral injury conducted by Neil Greenberg. I did have to fight for it, though, because academics, and I think if Chris was here, he might say that might agree with this, although I don't, which was moral injury is a thing you can't really research. You can't really demonstrate the evidence that says it's real. Neil Greenberg certainly proved that that isn't the case, and you can prove that moral injury is real and moral distress is real. And equally, you'll be surprised to know, she says, pierced and tattooed up, that I'm a progressive activist. And the kind of implications of that is that I experience quite a lot of moral injury because my progressive activist self, my very being, sometimes bats up against the fact that I'm a chief exec of an organisation and I have to make decisions all the time that sometimes I'd rather not make. But I would say the other dynamic of that is that I love a progressive activist until I have to manage one. And then we're in a whole different ballgame, aren't we? So apologies to anybody who's ever managed me previously. So look, we're going to listen to our wonderful Chief Exec, Thea Stein, who's going to talk us through her recent work around moral distress. Thea has been in post as Chief Exec of the Nuffield Trust since September 2023. She was previously Chief Exec at Leeds Community Healthcare NHS Trust, before then Chief Exec of Carers Trust, Yorkshire Forward and North East Leeds Primary Care Trust. That was a mouthful, I nearly never made it. Thea's held a load of roles in all sorts of organisations, and we're incredibly lucky to hear from her today. So I'll hand over to you, Thea, and then we'll come back for a panel discussion.
Thank you. Oh, I remembered I've got this on here. I can move, can't I? Right, okay. No? I'm quite distressed now already. Technical issue? Okay, so I'm going to start without my slides. So I became interested in thinking about moral distress, which is distinct from moral injury, a few years ago. And there's probably lots of roots to that. Inevitably, some of those roots come from my own experience of being a public leader. And therefore, I've reflected on that in the roles that I've had over many, many years. But I also became aware of the literature that was around about moral injury, which many people will be aware started in the army as a concept around soldiers in Vietnam, and became something that became part of discourse, particularly around doctors and nurses, around clinicians, and thinking about the moral distress as distinct from moral injury that people were experiencing. And what I became interested in was, and I guess it's inevitable given my roles, but what about those people who are leading? Are they leading as a sort of automaton that don't have these feelings or these experiences? And if they do have them, what do they do about them? So I started to do some work. And here's your definition of moral distress, which is the one that's used a lot and came from the 1980s. When one knows the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. So I just want you to keep that in mind as what I'm talking about when I'm talking about moral distress. So as I've said already, I know there's a lot of work in the literature around nurses and doctors. Ooh, I didn't do that. I didn't do that. Clearly it's going to be quite distressing, this. But I focused on CEOs. I actually wanted to focus on CEOs and directors of finance. We're lucky enough to have a very experienced director of finance on this panel we'll hear about from later. I just didn't have the capacity and time to interview and talk to everybody. I spoke to 15 CEOs. All of those conversations were anonymous. So all the quotes that you see will say, a CEO. And then they say, another CEO. So you're going to have to trust me, trust being the theme, that I really did speak to 15 people and not just sit in a room on my own. I set them up as conversations about difficult decision-making. Nobody was invited into a meeting with me or a conversation about, hey, do you want to come and talk about moral distress? It was, do you want to have a conversation about difficult decision? And also, to be clear, they were generally people I didn't know, because I know quite a lot of people across the sector, but they were generally people I didn't know. So I explored those questions that you can see there. Do CEOs experience moral distress? If they do, how do they cope with it? Does it contribute to the high turnover we're now seeing? Because if it does, that's interesting. And if it does exist, is it of academic, intellectual interest? But actually, so what? Why now? One of my colleagues said this picture was actually really, really scary. And I do appreciate there is something quite frightening about it. But I chose it actually because of that. There's a rigidity in that face, the rigidity in the smile, the it's going to be fine, everything is going to be fine, which I thought was somehow summed something up for me, which is why I chose it. But why did I do it now as well? I think you could do it any time, of course you could. But these things are all things that we know about. The workforce is under strain, we've got strikes, we've had staff shortages, we've got low morale. We have extraordinary structural change going on at the moment. All parts are moving. We also have a very, very strong political narrative. I mean, it's always strong, but I think it's particularly strong, which has been, we are going to cut roles in order to make sure the front line have resources. We're going to get rid of pen pushers. We're going to get rid of bureaucrats. It's a very, very strong political narrative. I understand it, but it's very strong. We also have a very strong narrative, which is, why can't you, Thea, be as good as that organization over there? Why can't we just bring the best to the rest? That's the phrase. Why can't you be the best? Why are you the rest? And there could be all sorts of structural reasons. We've already heard Sarah talk about structural reasons. And of course, we have the narrative as well that AI will save us. You know, you just AI will save us. And if you could just get it right, if you could just get a grip, if you could just sort yourself out, possibly by Friday, everything would be all right. And so that's why the picture appeals to me. I think it does matter because I think this is part of why we're seeing high turnover of CEOs. It's a hypothesis I've got. You may very well disagree with me, that's fine. I think it's part of why we're seeing high turnover of CEOs. It's a hypothesis I've got. You may very well disagree with me, that's fine. I think it's part of why we're seeing high turnover of CEOs. It's a hypothesis I've got. You may very well disagree with me, that's fine. I think that when we're talking about the regulation and professionalisation of managers and leaders, which we are in the NHS, and we've been talking about it particularly after Letby, we should know what we're regulating. You know, you've got to know what you're regulating to regulate and professionalise it. And I think part of understanding what the role is important if you're going to do that. I think we have a very prevalent model of a strong man, strong woman model of leadership at the moment. If you get grip, you're tenacious, you're resilient. I'll come back to the word resilient at another time. I really dislike the word resilient, for what it's worth. And I don't think that's a very good model for these times. And I think that's problematic. And despite, I've been CEO of a lot of organisations, and I used to think, well, you know, you're part of creating culture, you're this, that, and of course, we all know that the thing that creates the most culture for you as an individual, as somebody who's working, is your direct line manager. Your direct team and the culture in your team is direct line manager. But as a CEO, you actually do a lot to create culture, value. You are observed about what matters, how you react, what you are showing is important to you. And how you manage difficult decisions and how you manage in situations of moral distress matters. It doesn't come as any surprise to some people in this audience who've had been forced to listen to me now at 2 former summits that I think that a culture of psychological safety and of emotional intelligence is absolutely critical for people to flourish. So I think it's part of that conversation. Here are some quotes from a CEO, and a CEO, because nobody would talk to me on the record. What's difficult in the current climate isn't the decisions we make, it's challenging other people's decisions, those that are inappropriate or futile, and challenging poor behaviour. I thought to myself, I'm the breadwinner here. How am I going to navigate this without letting go of who I am? This was somebody who said, I spent all weekend working out if I got sacked for standing up for something, how long could I afford to survive financially? Actually, I've just started and they're telling me if I didn't sort the money out, I wouldn't be in a job for more than a year. So let's start with something really fantastic. Every single person I spoke to said they got significant satisfaction and pleasure from navigating and leading others through complexity. They absolutely said, I see moral distress in my working life regularly. Regularly. Nobody didn't say, everybody said, of course I see it. Of course I see it all the time. What they also said was, I get huge satisfaction from leading others, from being alongside people, of negotiating those waters with people. That's part of my job. It gives me value. I feel good about it. That intersects to an extent with experience and age. As I say, my sample's very small here. Somebody needs to find a PhD student who can do a proper piece of work. But it clearly is easier the more experienced you are, and that often intersects with age. There is an intersection with ethnicity and with gender, but again, my sample's very small, but it is as you would imagine. One question I asked all of my interviewees was, have you ever received a policy direction or guidance that you disagreed with ethically, that you thought was going to be really problematic to implement, that you didn't want to? My favourite answer to that from my 15 was somebody with great experience who ran a very big institution, who said, of course I do, regularly. I simply say no. I thought, yeah, lots of other people aren't. But there was a confidence that came from saying, I go back and say, no, this doesn't make sense. That isn't something that somebody running a very small institution, very early on in their career, ever felt able to do. One of the things that came through strongly was the support of the chair. It was absolutely critical. Every chief exec talked either about how they could do this work of difficult decisions, of pushing back, of having to go through these complicated waters because they were in lockstep with their chair, obviously with their executive team and with their board, but that relationship with the chair was critical. And in the longer piece I've written, I've talked about how two chief execs talk about, as the chair is changing, they feel that they may well have to leave the role. Now, there could have been a decision that the chair was changing and they wanted that individual to leave the role. I don't know that. But there was a very important relationship of trust and emotional support and psychological safety that made doing this work easier. On the whole, the people I spoke to recognized but were not suffering from moral distress. And that's important. So this isn't a talk about misery and overwhelm. It's a talk about how people were navigating those waters, often with huge pride and huge confidence. And the protective factors that are there for somebody who's a chief exec is control and agency. That is really important. The difference from being a chief exec in these situations is the control that you feel you have over a certain element of the work and the agency you have. That is different from the nurse who is nursing in a corridor, who is feeling overwhelmed and does not feel a sense of control and doesn't feel that sense of agency. However, they are only working for as long as they're working. And there are, of course, times when it fails. And the thing people talk to me the most about when I said, can you give me an example of a situation you think has caused you moral distress over the last year? It was nearly always about resource allocation and money. The most morally distressing experience I've had relates to managing the money this year. You won't be able to use that as an example, though, as it will identify me. By the time I'd spoken to the sixth person telling me that, I said, it's really not going to identify you. I can promise you this will not identify you, even if I told the whole story. But it wasn't really at root about money. It was about being trusted, about being listened to, believed, and being supported. And as I say those words out loud, I realize how resonant they are with the first session we've had today. And of course, I've done this work earlier and hadn't really thought about that in terms of the session we've had. But what it was that people were saying to me was, at a certain point, it becomes a tipping point for those people who did go into a state of moral distress. It became a significant issue and could lead to people saying they were going to leave. They couldn't do it anymore. And the most important issue was where you were coming forward and saying, I cannot do this CIP plan in the period you've given it to me to do. And not being listened to, not being understood. It's my word, ghosted. It's not a word I heard, it's my word. But that feeling of just being ghosted, yes, you can. Why can't you be like the best? Why do you continue to be like the rest? Why can't you get it together? Where the experience was of not being able to talk openly, not being able to share, not being able to really be honest, and being seen that if you did do that, you're just not strong and you're just not resilient. You're a bit of a wuss, really. I spoke to one person who had clearly experienced very significant moral injury. They did have PTSD and they were receiving support. They sought me out when they knew I was doing this work. I didn't re-traumatize them. They wanted to come and tell their story, which is what they chose to do. So what? Why does this matter? I mean, it matters because we're human, we're people, we care. I think it's really important because I think it is hidden emotional labor, but I also think it's an intrinsic part of public sector leadership. So it's both hidden and not properly talked about, but is actually something that we should celebrate. It is a different part of leadership, as far as I'm aware, from managing Sainsbury's. Maybe managing Sainsbury's has also got a lot of emotional labor that I don't know about, but it's something in public sector leadership. I think by continuing to celebrate particular models of leadership, we maybe crowd out our ability to really acknowledge, think about, celebrate, develop, and support this form of public sector leadership. Everybody I spoke to, one of my questions was, well, when you're feeling like this, when this happens to you, what do you do, where do you go? Of course, everybody had a colleague, a friend, somebody else. Often people say, I speak to people in another system. You know, people I used to work with over there, because I don't want to talk about people in my system. Because if I talk to people in my system, then it may get back and then people will see I'm weak. I think that if we're going to regulate and professionalise, and got nothing against any of that, then this understanding is part of that. It's part of understanding how we lead, how we regulate, how we turn up if we're CQC, and we talk to people about what does well-led mean? How did you manage this? That we see it as important and we celebrate it alongside people. And it becomes part of open conversations. I mean, I would say that, wouldn't I? I mean, this is what I believe in as well. As I've said 100 times, though, psychological safety and emotional intelligence and believing they're intrinsic to the good and excellent running of an organisation isn't something that is just nice. It is something that most organisations understand through the research and the literature is absolutely crucial. And for a person-led, person-focused organisation such as the Health Service, it continues to be remarkable how we don't take that on board. So for me, starting this work out of a curiosity about moral distress, it sort of brought me full circle back to thinking about what sort of model of public sector leadership do we want, and do we want to celebrate? And the reason I've got this picture is because of the story of what tree survives a storm. Because oak trees, which are very rigid, very big, very stable, they often come down. But willow trees survive. And that's because they're flexible, they're adaptive, they move. And I think they are a better model for the public sector leadership that is suitable for these times. Thank you.
Thank you so much, Thea. That was a really brilliant presentation. Thank you. And I like the idea of being a willow.
Good.
They are very pretty trees, frankly, aren't they?
Of course,
yeah.
Yes.
Okay, so look, we have a wonderful panel that we're going to invite to share their reflections, but I'm going to introduce them first. We have Hardev at the end there, who qualified as an accountant and has gone on, well, I'd hope so, and has gone on to take lots of leadership roles in the NHS over the last 15 years, is currently Deputy CEO and Group Chief Finance Officer at Bart's NHS Trust, just a little job then. And obviously you're a leader in the field of NHS finance, so we're very, very grateful to have you here with us today. And then the first of our two Lyns, Dame Lynn Owen, who's enjoyed a 35-year career in policing and national security, culminating in being Deputy Commissioner in the Met Police. I mean, wow. I have to say I'm a little bit kind of, fangirling over here from you. Led the National Crime Agency for over 5 years, led to transformation across policing, has been recognised more times than we can mention by through the Queen's Honours. Extraordinary to have you here. Thank you so much. And then Lynn Romeo, who I have known for a very long time, very much because you're a leading light in the social work world, the first ever chief social worker for adults in England at the Department for Health and Social Care, has over 46 years of experience, continues to be involved in health and care, and is an extraordinary mentor and inspiration for all of us who continue to roam around in social work circles. So again, great to have you here, Lynn. Thank you so much. So before we kind of get on to hearing from our audience, can I ask the group for some reflections? I mean, I'll leave mine to the end, actually, because I think we're more interested in what you've got to say. But Hardev, do you want to go first? In terms of what Thea's presented to us, what are your thoughts?
Yeah, so I think it resonated really well, particularly when you were talking about the listening piece and being trusted. And the reason that resonates more so is certainly in the work that I do in finance, there was a scenario some of you might remember where I spoke to the Health Service Journal on a Thursday afternoon in between meetings, and I thought nothing of it. And
they're over there, by the way.
I know they are. I know.
It was.
So I'm being very mindful what I'm saying. And then I came into work on Monday, and everything just exploded in terms of the messages and everything going on. And it was more about people ringing to say, I can't believe you said what everyone's been thinking, and
What did you say?
Yes.
What did you say?
Yeah, what did you say?
I would say, well, that's good. It's
Do we want to say it again? Maybe that's the problem.
So no, I was giving my personal perspective from a platform. I'm also the vice president at SIPA, which is the accountancy body. So I have an ability to talk about public finance in a way probably slightly different. And I did some commentary on the planning process and how it feels like we were being forced to deliver numbers that were unrealistic and trying to manage significant capital budgets, which are resources given to you as in this week to spend by the end of March, which is all unrealistic. So it was just a commentary piece about actually as CFOs, as professionals who come into working in a public service, not to feel trusted is undermining, and it really makes it really difficult to gain the confidence of your board and of the public when you're trying to manage resources as best you can. So it resonated with lots of people. It probably didn't go so well down up the line, I have to say. And lots of people rang me up afterwards and were asking me about, first question, have you still got a job? And then it was a case of, are you okay? And just checking in. And I was like, yeah, no, I'm fine. Mm-hmm. I had one person who rang me and said, look, I'm fairly new in post, but my board have read your article and told me that I need to now go to the Health Service Journal and make a statement as well. What do you think I should do? And it was a case of, yeah, I was fortunate enough to have that platform and speak. So, but it did resonate in the sense of people didn't feel confident to say some of the things I did, which was speaks sort of loudly to what Thea was saying about, again, we felt as a profession we weren't being listened to, and also we weren't feeling trusted. No CFO goes into the role thinking, I'm there to waste public money. So we're trying to do the best job we can as our CEOs. And I think we need to start the conversation with the same level of trust and openness and honesty. And as the willow tree demonstrates, you have to be flexible, but you have to trust each other to get to your destination. There's been lots of fallout from that, good and bad, but the main thing is I think we started the conversation, which has led to significant changes in the way we operate. But I would say there's still quite a lot to be done.
And so, Hardif, what I've heard you say is that, ultimately speaking out helped me manage the kind of moral injury distress bit from, potentially being set up to fail. But of course, it isn't without consequence.
And it's that bit that's really important. The fact that people still now, in my view, I each month I get several calls from people who are struggling. Relationships with the board, relationships with stakeholders, relationships with NHS England, just trying to navigate their way as best they can. And I've seen some really competent, able, capable people fall down into bits, and that's not nice. No. And I think from an NHS perspective, we've got to do better than that.
Indeed.
So I think for me, it's still out there. It's still, I think, not where we want to be. And yeah, it's a really helpful discussion. And I'm grateful to Thea for really raising this in the way that she has and having these conversations. And the more we do this, the more people will realise that actually this is something that needs to be addressed.
Indeed. Dame Lynn, I know you don't like the Dame bit, but I just have to differentiate. It's really amazing to have you here, because obviously it feels like the idea of moral distress and policing and criminal justice particularly is really important. Mind has done a huge amount of work around the blue light services, particularly led by Paul Farmer, who is probably right in my line of vision. If there's two mind leaders in a room at the same time, we might go into a portal, I don't know. But nonetheless, it's been a kind of feature of our work that we really understand the implications of what it is to be in the police. But what did you hear from Thea's presentation?
So I guess I want to start with where Thea ended, because I think public sector leadership is an absolute privilege, and I think there is a risk that if the public knew we were having this conversation, they might think it was a little bit self-indulgent. So I actually want to start with, why does this matter? And I think it matters, and Thea's research drew this out. It matters because we need really good people to be prepared to stand up and lead the health service, lead the police service at very difficult and changing times when the threats faced by our communities are significant. So what you don't want to do is operate in an environment where you have moral distress and therefore people are not stepping up and forward. So that's why it matters publicly. It matters because it has impact for public service. Thea and I have spoken. There is some difference in policing. So if you look at the post of a Chief Constable or the post of the Commissioner of the Metropolitan Police Service, it's a mixture of Chief Executive and Chair and Chief Operating Officer and Medical Director, I think, using NHS terms, all rolled into one. But there is enshrined in law something called operational independence. So Chief Constables and Commissioners hold very dearly their responsibility to talk candidly and publicly about the impact of the services that they are providing. But it's not quite as cut and dried as that, for all the reasons that you've just said about money. And actually, sometimes those are quite difficult conversations. And I think where I have landed over the years is I think we see a clamour from the health service, from the police service, to be candid at times when there is what I think you all call a never event. And I really support that. You know, Chris drew it out earlier, we have to speak with honesty and openness about things that haven't gone well in the provision of our services. And goodness me, I've seen the Met and other organisations I've been through move some of that. But you cannot cherry pick candour. So you can't say you need to be candid about the things that impact operationally and not be candid about the implication of budgets and the implications of money. And I feel that very, very strongly. And I think that is one way of dealing with moral distress. If you're going to speak openly, you have to speak openly about things that are difficult for everyone to hear, not just the organisation that you are working for. And then lastly, in policing, there is something called the national decision-making model, which actually puts some boundaries around how decisions are made. And in the very heart of that model, it talks about the value of integrity. And as a leader in policing, I felt very comfortable being very open and honest about the difficult choices that we were having to make. But that isn't to say, and I go back to the positive at the start of Thea's, it does need a certain type of person who is prepared to step into that. And I'm afraid sometimes that does mean you might feel personally under threat, but taking yourself back to what the public expect, what the public deserve, what the public need to understand is at the heart of everything I would say a public sector leader should do.
Thank you for that. I've just picked up another saying that I might just get tattooed. You can't cherry pick candour. I love that. I'll say that again in probably another 2 rooms today. That's amazing. And having seen you on interviews, I can definitely concur. That's how you approach them. Lynn?
Yes, I mean, a lot of it chimed, and especially that complexity and decision making. But I suppose the thing I wanted to reflect on was that social care has a very different context and history. When the NHS was set up, it was decided social care wouldn't be a universal service. It's not free at the point of delivery, it's means tested. There's eligibility criteria to see if you can get social care support, and it was very rooted in local government. So local authorities, councillors have a key role to play in connecting with their communities. We have 3 ward councillors for each ward. They have a connection on a day-to-day basis with their constituents and voters. And they rely on their chief exec of the council, their director of adult services and children's services. And when it was all set up in the first place in the 70s, it was a director of social services. And those workers working there and those directors were all social workers at the time. And that experience of moral distress and having to deal with the things you highlighted, Sarah, when you spoke to introduce the session, has been part and parcel of how that's evolved and developed over time. And I think that has informed maybe a slightly different leadership model and way of being, which is very much based on when you're setting the budget every year, you spend a lot of time working through it, both with each department, housing, environment, public health and so on, and social care, and with members having to agree that at a full council meeting. So there's a lot of tussling to work out, well, what are our priorities? How do we balance potholes with looking after Lynn's mum who needs care every day? Those are real dilemmas, but there's a lot of discussion and collaborative approach, and also obviously trying to tussle for resources. So I think that process roots it in much more of a collaborative, open discussion about what can we afford, who's going to do it, how do we do it, how do we support and listen to and understand what's going on for you, Lynn, as the Director of Adult Social Care, and how you need to balance all these things and meet your statutory duties, which of course, that is one of the big challenges for local authorities at the moment. They have a statutory duty to deliver in this statutory framework. And if they don't, they get into big trouble. And they also have to balance the budget every year. So it's quite a different template. And I think I think because it's been based on social work in its broader sense, not just registered qualified social workers, but social work and social care, the values and ethics and absolute focus on what are the best outcomes for our people, both individuals and communities. How do we keep them safe, and how do we support work, really listening to understand, but working alongside and with and from people to get the right sort of care and support that matters to them and makes a difference. So all that connection with the community, with voluntary sector organisations, with the partnership arrangements. Navigating the complexity of partnerships requires deep listening, understanding what are the things that matter to you, how do I get alongside and help that balance out. So I think it's a different model, and I think it goes back to it being based on, at an individual frontline level, as a social worker going in to deal with a situation like that, I need time to step back and have proper, professional, reflective supervision time where I can think about how that's impacting on me, how that might impact on the people I'm working with, and how do I think about and work with those feelings and take the right action, which I think then has percolated up to people who lead. And obviously on the other side of things, I'm talking about the local authority perspective, but of course since we've outsourced or put a lot of provision into the independent sector, those different models of leadership will play out differently as well. So you can have small family businesses running care provision, whether it's home care or care homes, but also big multinationals now running chains of. That model of leadership might be quite different, but when I visit care providers, what I find is what really matters is the leadership on the ground with that team, and that sense of we're a team here, how do we look after people, how do we support them, supervise them, give them chances for personal development. I think that's the model I think hopefully we can all hang on to, because I agree with you, people came into social care and still do, I think, because they want to make a difference. They believe in people and their communities and want to make life better for people, and we want people to keep doing that.
Indeed. Thea, you and I share a dislike for the word resilience because it individualises a problem that we know so much is about systems. bearing in mind what we've heard, from the panel, what's been really interesting is that themes of, money clearly is still the root of all evil. So we agree on that. There are consequences to the mitigants against moral distress. So if we think about the mitigants of speaking up or working in partnership, there are consequences to that. And are we live and do we understand it? How close or how often do leaders reflect? And it's not just about reflection, it's about reflexivity, that kind of critical analysis of what you're doing and how you're doing it. And then the value for who? You, our beneficiaries, our stakeholders, workforce. Is there anything you want to add, Thea, before we open it up for questions?
There was one thing, listening to people on the panel talking, I realised I spoke about it in what I've written, but didn't bring it out as I spoke, is that several of the chief execs I met came from a background as either a doctor or a nurse. And you talk, both of you have talked about professional frameworks, and of course the professional framework of being finance, but what was clear, those chief execs who had been a doctor or had been a nurse, all talked about how important that was at the moment of the greatest potential moral distress or moral injury. Because I'd say to people, what do you use? What's your thinking? What's your framework? How do you navigate? All of the clinicians talked about those professional frameworks. And actually the people who came from a nursing background in particular really talked about how they used that framework to navigate and indeed give them strength and give them the ability to go, no, or it's not right, or this is where I'm going. And I'm not for one moment saying that those people who didn't have those backgrounds didn't have frameworks, but they were often frameworks they brought from their own ethical background, their religious background, their family backgrounds. The professionals had something that they said, several people I spoke to said, there were two people, I'm still a registered nurse. I'm still a registered nurse as well as a chief exec. And I use those frameworks.
It's interesting and really important. And I feel that as a social worker, that's my frame of reference. Okay, so bearing in mind what Thea said at the beginning, which was people find it quite difficult to talk about this, and there was a kind of big desire for confidentiality. Have we got anybody in the room who would like to ask the first question? It'd be really great. Wonderful. Look, I mean, we really want to have an open conversation. We've got 20 minutes, and I know we're just holding you back from lunch, but let's give it all we have.
Thank you. I'm Jason Dawes. I'm the Chief Finance Officer from Oxford University Hospitals. And my question is actually not about money per se, although I agree with everything Hard ever observed with knobs on. I wonder, Thea, although any panelists can comment, if you've possibly understated how tough things are. I'm a former parent and governor of a primary school in Reading, where there's a well-publicised case of the head teacher who I appointed died by suicide after an Ofsted inspection. I wonder how close we are to that sort of outcome in health. I wonder if anything, you've understated things. I wonder if you've talked to managers in partnership about if they have any data. I think things are possibly even worse than your publication yesterday, which I read, made out.
I just before you answer that, thank you for saying that, and love and solidarity to you, because I can imagine that was an incredibly difficult time. So thank you for the question and for the sharing the story. Thank you, Thea.
It's difficult, isn't it? I didn't speak to MIP, and that's a good idea actually. In terms of further work, I was saying to somebody over coffee earlier, I feel like what I've done is sort of just plotted some of the field in which other people, maybe myself as well, can do more work. I think for some people it is really, really bad. As I said, I found one person who made their way to me and wanted to talk to me to tell their story and was suffering from classical sort of PTSD. I hope it's not worse. It may be. I can only repeat what I saw. And I did want to make sure that I highlighted something that I thought was incredibly important, which I think I'd find in DOFs as well if I spoke to the directors of finance, which was the sense of pride for a certain amount of time that people got from being strong in these situations, from being able to navigate. But there is that point where the weathering, it just wore people down. I would hope we don't see a situation as you unfortunately saw in your school, but I definitely take that point.
Any other thoughts about that from the panel? I mean, is it
happened in
worse or
policing?
better?
Yeah, so it's interesting that in your school example, it was inspection.
Yeah.
So I think what you've got is you've got the public sector under layers of stress. So you have running the organisation, having to make difficult choices, and often, sometimes, maybe not often, but seeing things go wrong that feels like failure, individual, organisational. You then overlay that with inspection and regulation regimes that sometimes look at things through very narrow or limited lenses. And I then think you overlay that with the way media and or big P politicians sometimes respond to those reports. And I think it's that layering that causes the effect. And I think we have seen some of that in policing. You know, there are very many fewer people now applying for the top posts in policing than there used to be.
Yeah, I think.
Yes, I don't think didn't resonate with me that in on the social care side, although obviously the challenges of trying to do more with less and always having to cut your cloth, as I said earlier, that's been going on since I was since I've been working. But I also think there is something about the leader of the council, the lead member, the cabinet, and the senior management team sitting alongside with the chief exec, the directors of adult social services, but also, I guess, their partnership with the providers as well, that makes it more of a collective thing. It doesn't feel that individual responsibility, and carrying that moral distress maybe isn't as significant.
Yeah, yes. And I think there is we've seen quite a few high-profile incidents reported in the media where, whether it's around maternity services or around individuals causing distress within organisations, where the law and the politics is moving towards, rather than corporate charges, more about personal charges. And I think there is a growing appetite for people, boards, individuals on boards to be held more accountable, yes, rather than hiding behind organisations. So that, I think, depends where you sit on that perspective. That might be a worrying trend, that might be something where people are held more accountable, but certainly chief execs and board members, what they've signed up to has changed, and I think will continue to do so, as public services will be looking for more individuals being held to account rather than organisations.
Indeed, and what has come to my mind is the role of public scrutiny and public shaming. And we know kind of very much locally if there is a poor performing school, or teachers, the head teachers are very, very likely to be pilloried locally by their local community. And so the kind of open house on leadership, I think, in terms of criticism makes, I suppose, corrodes the moral distress.
Can be.
Yeah. Any other questions, reflections? We have one here and then one to the left of the room. My left.
Should we take both?
Yeah.
Thank you. I'm Nadia Amir, and I am the chair of National Care Association, so I support small to medium-sized providers. And that was really fascinating, Thea, from the perspective where the CEOs you've spoken to. So we speak to a lot of care providers who are obviously independent care providers, and the pressures that they suffer. But we have two layers. We have the provider, potentially, and we have managers. And having been somebody who closed my own home, some years ago, the emotional pressure, the moral pressure, the feeling of letting people down is just beyond comprehension in many ways. think it is really important to acknowledge that the social care sector goes through this as well, but they go through it in a different way. And I'd be really fascinated if you spoke to chief execs of social care providers, small and large, what sort of picture you'd get. I suspect it will be very similar, especially as we went through COVID, we kept hearing about it. And there is this huge moral thing about, you know, not letting people down. Because we look after vulnerable people, there is all of that consistently there. And then, of course, of the workforce as well. So I think the pressures on social care are there as well, but there is very little support outside for anybody to try and understand that challenge. Mm-hmm. And as a sector that is consistently under stress, you just imagine the leaders who are sitting there trying to do the best that they can, and how they kind of come out of it. So it would be fascinating for me to understand whether you had any social care people that you spoke to, but if you did, I wonder what you'd come out with on that one as well.
Yeah, no, I could spend the rest of my career very happily going and interviewing people in all sectors about this, and just around public sector leadership, but this was a very clear, very small, particular cohort. Yeah.
I think you could argue the same for charity leadership. We've got a great Richmond Group cohort here today. I can see you. I'm not hiding. And I'd love to come to you in a minute, actually, someone from the Richmond Group, Julep, if they don't put their hands up and come to you. We had a question over here, and then we'll come back to the Richmond Group, if that's okay, somebody. I think that guy there. Yeah. HSJ.
Hello, James Ullman from HSJ. So, Hardeep, your comments and your article really resonated with our readers, and I actually think it has paved the way for more people to come out and say similarly candid things, and I appreciate it has consequences. I did just want to come back to your comment, and I'd appreciate the reflection of the rest of the panel on this too. You said that it didn't go down well up the line, which, and I was just wondering really, do you get a sense that at a national level there are people who are keen to see the kind of behavioural and cultural change that you're talking about? And if they are, what would your advice be to them? And yeah, like I say, appreciate everyone's take on that.
Hashtag be more Hardev, because I think that's talking about bravery there, isn't it?
Well, I wouldn't say that, to be honest.
Well, I've written it down now. That's true.
Yeah, so this is just between me and you. Yeah.
Yes.
So I think, so if I stand back, so as I mentioned, one role I occupy is sort of Vice President of SIPA, which is the accountancy body. And I was heavily involved in developing an ethics framework, which goes back to the points raised around that professional framework. Where can people go to if they have some of these issues that they feel they're being compromised and need advice and support? So I think that happens from a finance perspective, and all the other accountancy bodies are now rolling out something similar. What I would say is that certainly since that article, thanks to you and your colleagues, there's more of that discussion happening at NHS England national level. So I think there's definitely been a shift, and there's definitely been more appreciation that there's a listening job to be done, and we need to take people with us on this. And the changes that have happened at NHS England, I think, have been helpful. So just between me and you, so Jim Mackey did collar me in the toilet recently to ask me about what happened after that article went live. And you know, so we had a good, helpful conversation about that, and he was very much open to understanding about how he can help support the profession. He's a former CFO as well. So I think, you know, there are some good intentions there. How that translates to, you know, a finite budget, delivery, a manifesto from the government that needs to be delivered. It varies from region to region and system to system. But I certainly think that there has been a shift in the right direction, and I'm more optimistic that there's levels of support for people out there, and we are having more of those healthy discussions. And I personally am involved. I'm working on this with the national team on how they can take a more active role in developing a framework that supports certainly CFOs and chief execs in managing these big challenges.
Thank you. What I got from that was that it's great to know that men chat in toilets too. Great. Look, Richmond Group Charities, who would like to talk about moral distress?
Paul's waving at you.
Paul? Thanks, Paul. I knew you were in my line of sight.
Exactly, Sarah. Hello, everyone. Paul Farmer, Chief Exec at Age UK, incoming chair of the Richmond Group, also non-exec of Frimley. Welcome to Frimley, everyone, just in case you're wondering where you were in ICB land, shortly to become the Thames Valley. First of all, thank you very much for running this session. It's so important that we create the space for these conversations to happen. It really is. And this is also a reflection of people being generally more comfortable, being more open about how they feel about their life and their jobs. And these two things are, in these jobs, they're one and the same in many cases. So thank you for that. I think anybody who is operating in a leadership role where there are other humans that we are not just working with but supporting need to have these conversations about how safe and comfortable we feel. And we also need the right people to be able to relate to. And I think it's be really interesting to, if this work is going to carry on, Thea, and I really hope it does, think about how you create those spaces where people feel comfortable, because I think that's a very important part of this environment. Just a couple of things I thought would be useful just to throw into this. First of all, that somebody else has mentioned the question about next tier. I think this is super. If we are really going to build a leadership for the future, it's really important that we invest in people's capability to be able to be comfortable being uncomfortable. And I think how we do that is really important. I worry quite a lot about that next tier. So thinking about those people who are responsible for leadership development programs, next generation programs, please think about how you inject these conversations into every type of leadership. And it's thank you, Hardiv, because a lot of people think, well, finance people don't face pressure. Of course you do. And it's really important that we recognise that everybody in these spaces are facing pressure. And then just a final point about boards. Now, as a non-exec, as a board member, boards have real responsibility to create that space, not to cause more trouble. So I think there's something about how we think here about the execs and the non-execs working in those spaces to create those safe environments. And finally, just to be really honest about this, none of us has Teflon. Every single one of us will have our limit. And the really important thing is to know where that limit is. If we don't know where that limit is, I suggest we all go and find that today, because that's really, really important. However, we have this impression, and the Lynns, I'd be interested in your thoughts on this, that we are actually somehow superhuman. Indeed. And none of us are. And it's really important that we know that. Thanks.
I love that, Paul. Thank you so much. I always appreciate your interventions. And I think there's something for me about that very point about succession planning, how are we supporting younger leaders coming through. I think there's something about gender that we haven't really spoken about, how that plays out, and it kind of implicates moral distress when you talk about the model of leadership that is in operation as we speak. Bearing in mind what Paul said and all of the questions so far, it would be great to get kind of final comments from each of you, and then we can kind of draw the session to a close. Unless there's a burning question. I'm looking at you like, is there a burning question? No. Okay, let's take final comments. Hardiv, you go first.
So look, I think it's really helpful to have those discussions in the safe space, psychological safety. So whether you're any type of board member, is to really open up that discussion because not all these decisions are difficult. And being a board member, whether you're chief executive or CFO, they are very lonely jobs, and people do close the door and think, what the hell have I just got into? And so having those conversations as a collective will make you all individually and as a team much, much stronger. And hopefully with that, you can really make the right decision.
Thank you. Great advice.
Can I make 2 points, one on board and one on resilience?
Please do, yeah.
So on boards, the best boards I have seen operate actually genuinely listen to the people that are presenting the papers. But I have seen many boards that don't, and I've seen many boards encourage papers that rose tint or selectively report risk in a way that leaves the board feeling very comfortable where they have their sandwich lunch. So my genuine plea for anyone in this room who is in boards is you create the environment for your people. Actually, do you enable them to come forward and give you very honest feedback about how they are feeling and what is happening? Or do you overreact to something on those dreaded red, amber and green things that we all get? And when something's red, you actually don't really care what the answer is as long as they make it amber. Because in organisations where I've seen things go wrong, people have put things at amber that really haven't been amber, but they've wanted to reassure, in some instances, me. So, I'm not hiding from my own personal accountability here. Which does go to your second point, which is on resilience. I'm not sure that it is possible to know what your own resilience limit is, and I say that very personally. I was an assistant commissioner in the Met in 2011. The highs of William and Kate's wedding, the lows of the riots. Actually, that felt okay. Something happened a few months later, and it suddenly didn't feel quite so okay, even though that was a horrendous time. And I think it sometimes overlaps with what's going on in your personal life. So I think actually you can have a high level of the dreaded word resilience, which suddenly drops, or actually you can be ticking over and you think just fine, and then something happens, you encounter an individual who's difficult, or something changes in your personal circumstances, and it's then you dip. So I don't think it's about knowing your exact level of resilience in any time. It's knowing the highs and lows of resilience and what might be the things that prompt them for you personally, and then creating a team of people around you that are very different to you, that aren't your friends, but that will have the confidence to say to you, you are acting outside of your norm. And therefore you need to change. And I think too many people in public service surround themselves with people who will say, they're there, you're very important, you're very special, and actually that isn't helpful. What you need is somebody to say to you, I don't know what's going on with you at the moment, but your behaviour just isn't good enough.
Yeah, that's a great point. When I start a job, I always say to my leadership team, if I start asking about timesheets and spreadsheets or correct your grammar, know that there's a problem, because I don't really care about those things. And it's okay to say what the hell's going on. So really good point, and thank you, Lynn.
Yeah, just to build on that, I think a coaching, mentoring type model really helps in these situations. And I also think taking agency and control. So one of the things to reflect on, I think, in the social care, well, certainly the local authority side and in the provider side actually, is there's an association of directors of adult social services. There are lots of networks there, lots of support, and a lot of lobbying and campaigning that will go on through that, as with the National Care Association and so on. So those sorts of structures and support can make a difference for people. And on the leadership and developing our next leaders, one of the things we were able to really bed down on this social care side was putting in place a principal social workers network to try and grow and develop them into the next people who would step into leadership, because there wasn't really a career pathway to, well, who are going to be our leaders, who is going to step up to be assistant directors or directors. So that's been a really good pipeline to set up. A lot more to do, of course, and others from other professions or backgrounds need to step into those roles as well. So I know ADAS and others and the Local Government Association do run leadership type as Skills for Care do. So I think those sorts of enablers and helpers can really make a difference to growing our next tier of leaders.
Yeah, I think that's exactly right. You can never underestimate the role of peer support, particularly in terms of a mitigant either. But final word to you, Thea.
Thanks. Just been so fascinating and interesting to listen to everybody. I think the one thing I'd come back to was something I've said several times. This is something everybody did that I spoke to. Most people were still surviving and thriving. They were some people who were clearly getting overwhelmed. what I came away with was doing what we've done in this room today, which in a sense is bearing witness, is saying it happens, people do it. Nobody was saying they didn't expect to make difficult decisions. Nobody was saying they didn't expect to balance the books. Nobody was saying they didn't expect it to be hard. But there was, where it worked well was because it was seen, it was understood, it was supported, and it was recognised by their board and by their peer group. And that, I think, is what we need to do to accept what a wonderful thing it is as part of public sector leadership.
Thank you so much. Look, let's say thank you to our wonderful panel and then lunch.